Bell's palsy is a medical condition that causes sudden, temporary weakness or paralysis of the muscles on one side of the face. It results from damage or inflammation of the facial nerve, which controls the muscles responsible for facial expressions. The exact cause of Bell's palsy is often unknown, but it is thought to be related. Bell's palsy is a medical condition that causes sudden, temporary weakness or paralysis of the muscles on one side of the face. It results from damage or inflammation of the facial nerve, which controls the muscles responsible for facial expressions. The exact cause of Bell's palsy is often unknown, but it is thought to be related to viral infections, especially the herpes simplex virus. History of Bell's palsy. Bell's palsy is named after Sir Charles Bell, a Scottish surgeon who first described the condition in the early 19th century. He published his observations in 1821, although the condition had likely been recognized by earlier physicians. Bell's contributions to understanding the facial nerve and this particular condition remain significant in the history of medicine. The symptoms of Bell's palsy can vary in severity, but typically affect only one side of the face. Common symptoms include sudden weakness or paralysis. Typically, one side of the face experiences sudden weakness or paralysis, leading to drooping of the mouth, difficulty in closing one eye, and decreased ability to make facial expressions. Facial droop. The affected side of the face may droop, and the smile may appear uneven. Some individuals may experience a loss of taste on the front two-thirds of the tongue. Increased sensitivity to sound. Sounds may be louder in one ear, known as hyperacusis. Drooping of the eyelid. The eyelid on the affected side may droop, ptosis, making it difficult to fully close the eye. There may be increased tearing in one eye due to inadequate eyelid closure. Dry eye. Insufficient blinking can lead to dryness and irritation in the affected eye. Effects of Bell's palsy. The effects of Bell's palsy can vary from person to person. Most individuals with Bell's palsy recover fully or nearly fully, typically within a few weeks to a few months. However, some individuals may experience long-term or permanent complications, such as facial muscle weakness or twitching, incomplete recovery of facial function. Synkinesis, a condition where unintended facial muscle movements occur when trying to make other facial expressions. Psychological and emotional distress due to changes in facial appearance. Famous individuals who have had Bell's palsy. Several well-known individuals have experienced Bell's palsy, including actors George Clooney and Pierce Brosnan. It's a condition that can affect anyone regardless of their celebrity status or occupation. Prevention and cure. Preventing Bell's palsy is challenging because the exact cause is often unknown. However, there are general steps to maintain overall health and minimize the risk of infections or inflammation, reducing stress and maintaining a strong immune system. Practicing good hygiene to reduce the risk of infections, maintaining a balanced diet, and regular exercise for overall well-being. There is no specific cure for Bell's palsy, but the condition often improves and resolves on its own. Treatment options include medications, antivirals, and corticosteroids, physical therapy, eye care, and, in rare cases, surgery. It's crucial to consult a healthcare professional for an accurate diagnosis and treatment recommendations if you suspect you have Bell's palsy. The prognosis for Bell's palsy is generally good, with most people recovering over time.